What's going on, good people? Today we're going to talk about what is therapy. What's going on, good people? It's your boy James Harris, founder of a movement called Men to Heal, which focuses on men's overall wellness, their mental health, as well as their physical health. And I'm also the author of Man Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. You can get that on Amazon, Barnes& and Nobles, Target, Walmart, pretty much anywhere books are sold. I definitely appreciate the spouses who've been purchasing this book for their loved ones and engaging over dinner, a date night exercise. I appreciate that. And special salute to my fellow colleagues who got this as a tool and interventions that they use in their practice or got in their lobbies for just a conversation starter. And also, I would like to thank the parents who got this book for their young ones to have it as a gauge to see if they still, triggered by some things or improving in certain areas. So I definitely appreciate everybody who supported the book. Make sure you like, share, subscribe to this channel. Submit me your questions if you have them. So today we're going to talk about what is therapy. That's a question I know I personally get asked a lot, so I figure I'll do my due diligence and put it out there for the masses so they can receive the information, because there's so much misinformation or incorrect information on what takes place in a therapy session, what therapy actually is. It's a lot of confusion, so I'll do my best to ensure that your questions are answered. So pretty much psychotherapy is just another form of way or saying talk therapy. It's the treatment aimed to relieve emotional distress or mental health problems, provided by somebody of a variety of backgrounds. You got psychologists, psychiatrists, social workers, licensed professional counselors. A host of clinicians are able to do psychotherapy. It involves examining and gaining insight, into different aspects of your life, the different choices that you make, or difficulties that individual may face. So I also do couples, individuals, adolescents, adults. I pretty much got a wide range on my caseload. Therapy sessions refer to a structural meeting between a licensed provider and a client to meet the goals and the aspects that are dealing with within your life. Pretty much talk therapy or psychotherapy encompasses many different treatment aspects. Wide range of clinicians use this tool. As I highlighted, psychiatrists, psychologists, LCSWs, LPCs, pretty much a lot of clinicians go to this. But of course, you got play therapy, you got other forms of therapy as well. But psychotherapy is pretty much one of the wide range ones that's used. It's a critical aspect that the client works in a collaborative effort with the therapist. It's not my process, it's your process. We're working together on a unified front to, create a structured treatment plan and allow you to have positive changes over a period of time. Like the beginning of therapy, it differs for different clinicians. I can't really speak to what anybody else do. Some people feel strong support system and no diagnosable mental illness still benefit from therapy. So you can have everything you feel going correct within your life and still want to benefit from therapy. You don't have to have a certain or particular diagnosis to engage in therapy. You can have that maintenance or that check in progress to ensure that you stay where you need to be. If you experience a prolonged periods of anger, sadness, anxiety, or struggling with relationship conflicts or communication problems, these are some of the people who are most drawn to therapy. The media push those people to therapy. Like if you're trying to cope with a specific painful event, like a death of a loved one, a breakup, a loss of a job, gambling, self-esteem issues, other forms of reckless behavior, those tend to be the more catered to views of what therapy, what people should go to therapy for. But again, you can be perfectly fine within your specific self, your character, and you just want somebody to process information with, especially during this time of COVID or during this time of the so much violence in the news. Some people just want to offload their stress onto somebody who can help them manage. you should definitely go to therapy. Regardless of your specific challenges, you can benefit from having an impartial observer, to listen to you, a professional that's non-judgmental, that will keep your information confidential, will not, just put your business out there, because I know that's a big question that come up as well. Strong negative emotions aren't the only reasons someone should seek therapy. Again, I just gave you a whole list of reasons why a lot of people do seek therapy, but I also made sure that I mentioned that you can just go to therapy as a way to process. Some people have those relationship challenges or feel stuck in their career, substance use issues, trying to cope with unpleasant events. A lot of people also go to therapy because they feel disconnected from people and may find the therapeutic process helpful. When you feel sad or anxious or overwhelmed or irritable, talk it out. That's tend to normally help you. A lot of people don't know those coping mechanisms to develop on their own. So it's good to have like a guide, somebody to push you and encourage you and direct you in such a way to accomplish a certain mission. And when you're looking for a therapist, make sure that you find somebody who you feel is able to suit your need. There are countless compassionate and effective therapists out there, but no single therapist is the right person for everybody. You gotta. It's just like a car. You gotta continue to shop around, and you can do that. You definitely should do that as well, because it's your process. You want to ensure that you get a quality service. Finding the right therapist usually, is based on trial and error. You can call a couple different people. You're gonna review profiles online. You're gonna do different things. Your insurance company might even send you a list of providers that they feel should work. Or you might just hear word of mouth. You might know a friend of a friend that is working wonders with this specific therapist. So referrals are definitely helpful. A potential good fit is based on the therapist modality, based on your need. I know my specific modality, I tend to use a lot of CBT, which is cognitive behavior therapy, as well as reality therapy. And that's based on the population I tend to serve. However, I am eclectic when I need to be. I can adjust based on my client need. But you also can seek a therapist who fit the gender criteria that you're seeking for, the ethnicity criteria. Ensure that they're culturally competent. Don't get cultural competence confused with being from the culture. You definitely want to ensure that you get a therapist who is able to understand specific things that you are probably having difficulty with or challenge with on a day-to-day basis. So again, do your due diligence. Make sure you're in a position to find somebody who's willing to treat you the way that you deserve to be treated. To be honest with you, it's a lot of therapists out there who are qualified, but then, like anything, it's a lot of therapists out there who are unqualified or either just practice unethically. So you definitely got to ensure that research component is in there. Even the best therapists aren't perfect. Again, people have their days, people have their biases that they tend to push on people. So it's a difference. You definitely got to ensure that you're putting yourself in a position to find your effective therapist. And make sure they're ethical. Therapists make mistakes. It could be inadvertently, or like I said, they could push that bias on you, whether it's religion or sexuality or whatever the case is. But just make sure that you find somebody that you can trust with different things, that won't share your inappropriate details about, something that you disclose to them, or me share my inappropriate details about my life with you, because that can put a strain on our relationship as well, in regards to transference and counter-transference. You want to make sure that it's non-judgmental, it's not condescending. And unethical therapists, you probably have somebody who is voided based confidentiality and stuff like that. So you definitely want to ensure that you're not putting yourself in a position to have a romantic or sexual relationship with your therapist, because they understand the power differential, your vulnerabilities, all of those things can happen. So just be cautious. You don't want to be in a position to where you're getting blackmailed or having a breach of confidentiality. So again, therapy and therapists is a human process, and therapists are human. So things happen. That's why it's important to make sure that you're screening different therapists to find somebody who's suitable for you. Different situations can happen. Different situations definitely arise. So just make sure that you find a therapist that can fit your need and that you can have an invaluable experience and grow within self or whatever issues that you're potentially presenting. Therapy is definitely a valuable tool that can help you solve problems or set different achievement goals, improve your communication skills, teach you new ways to track your emotions, and keep your stress levels down, ensure that you know the proper skills to identify triggers and prevent different things. Like, all of those things are important. You probably want a career therapist to help you get over the hump, the next level of like finding your passion within your career or within relationships. Like, those things are important. It's so many different interventions out there as far as self-care, proper rest, diet, low stress, positive people, strong support system, talking to people in the barbershop. All of those things are therapeutic, and they shouldn't replace an actual therapist, because the therapist, the knowledge that we possess is the countless number of case studies and clients we've treated would definitely assist us in helping you navigate your journey. So, hey, drop me a comment. Let me know what you think. How do you feel about your specific therapist? How you find your therapist? Any tips on how somebody else can find that therapist? So make sure y'all like, share, subscribe. Definitely appreciate you. Look forward to next week. I am probably going to be talking about what happens in your intake session, and then probably after that we'll be talking about what happens in your first therapy session. Of course, it's different from every therapist, but I'll give y'all a couple secrets on what I do in my session. So feel free to hit me up, man. mentoheal.com, mentoheal.com. Submit me your questions, send me your inboxes. Also, like, share, subscribe. Appreciate you.